Ladies and gentlemen, thank you for standing by. My name is Daphne Worrell, Marketing Manager for ODG by MCG, and I'm excited to welcome you to today's webinar, Introducing the New ODG by MCG. During this webinar, all participants will be in a listen-only mode. If you'd like to ask a question, please use the chat feature located in the lower corner of your screen. We'll save some time at the end for a few questions, and any questions that we don't get to, we will respond through email following the webinar. The webinar is being recorded, and the recording will be sent to you within 1 week. Our presenter today is John Nelson, Director of Sales for ODG by MCG. John has been in the insurance and healthcare industry for over 20 years, with expertise focused on where healthcare delivery intersects with technology, specifically in the areas of workers' compensation, disability, and absence management. John has built solid relationships and helped operationalize evidence-based return-to-work and treatment guideline solutions with some of the industry's largest insurance companies, hospital systems, third-party administrators, employers, and governments across the world. John has a strategic focus on data analytics, benchmarking, and decision support and integration of ODG within claim systems. So John, you can take it from here.
Great. Thank you, Daphne, for the introduction. Let me go ahead. I'm going to share my desktop out so everyone can see my screen. Hi, and thanks again, Daphne. My name is John Nelson. I'm the Director of Sales for ODG. I will be the presenter for today's monthly intro to ODG by MCG. As many of you already know, in January of 2017, ODG was acquired by MCG, which is part of the Hearst Health Network. I do have kind of a strategic focus on data analytics and especially integration of ODG into software applications, bill review systems for decision support. So I will touch a little bit more on those types of functionality today. Early on, we knew one of our strategic initiatives and major investments was to upgrade the ODG website through the acquisition. We received an overwhelmingly positive response to this new ODG by MCG site that I'll be showing you today. And some of the feedback is the site is fast, intuitive, actionable, configurable, and contains more functionality than our existing legacy site. We will keep both applications or websites running simultaneously, but we do plan to sunset the legacy version of ODG sometime in the near future in hopes that most of our customers have already migrated over. As we mentioned earlier, the goal of today is to provide a comprehensive demonstration of the new ODG by MCG website. I will start with how to search the guidelines, but then we'll pick a medical condition and run through the various tabs: duration first, job profiler, then cost, followed by the treatment, TAL, and formulary. Everyone will be in listen-only mode, and I can take live questions at the end. As you can see from the home page, at the heart of the site, we keep the core solutions of ODG, the evidence-based duration, treatment guidelines, and cost. All three are very interrelated in that a longer a case typically goes on, the more it will cost and the more treatments typically will happen. The functionality tabs located horizontally here all correlate to the various three tabs. So duration to duration, the treatment, the TAL, and the formula treatment, the cost to the cost tab, and then last but not least, we've added a job profile tab, which consists of a job-based data bank of over 30,000 jobs with full descriptions. This modern design takes on a tabular approach, and we architected the website with the deep linking theme in mind, where we present the most important information up front with the ability to dig in deeper if time permits. The reason why we did this is we know users of our product are very busy, and so they need to find that information quick, readily, at their fingertips. And if they have time and they want to learn more, I think you'll see the way that we've architected it allows them to kind of link in further to the various different evidence and so forth. I always like to start off these demonstrations by commending the frontline users on the phone today. We understand you have very busy workloads and caseloads. You're looking to find information readily. Human intervention, or what you are doing on a daily basis, is the most important part of this process, and our guidelines can be used as a framework of dialogue to help getting everyone working towards common goals and expectations, which is really to help people back to functional improvement. So again, the human intervention is very, very important. These guidelines can help you back the decisions that you're making on a daily basis. So with that said, let's dive right in with the search. there's various different ways to search the ODG guidelines database. I'd like to start off with a little trick though. If you look up here where I'm pointing to the code section and you click on that, you'll notice it says ODG medical topics, which it defaults to, and then you'll see ICD-9, ICD-10, CPT, NDC, HCPCS. These are all the various different provisioning search functionality that you can click on. I'd like to especially choose ICD-10. I think as a user of our product, even if you're not receiving the ICD-10 code in, it tends to expand the search results. And let me show you a few examples, because what we've tried to do here is really mimic the Google search type functionality in that you can start typing in a medical condition name like carpal tunnel, and as I type that in, it predicts out to what you're looking for. So you'll see topics under duration, the medical topics, but then you'll see it gets a little bit more specific with the ICD-10 codes, and then it drops into the treatment. You will see green check marks appear in the functionality tabs where we contain information. So let's go through just a few other quick examples here. You could type in hip replacement. And as you start typing it in, again, it predicts out to what you're typing. So the better you know the actual condition name, the better it predicts out to what you're looking for. Just as a few other examples, you could type in rotator cuff. Again, it's going to give you the check marks in the functionality tab where we contain information. Search them, and then from here, you're kind of just picking on the condition that best describes the patient that has this medical topic. You can also search in here by procedures by simply typing in MRI. So if you were looking for the MRI of a back, for instance, you could click here. You could type in physical therapy. You could type in laminectomy. Essentially, as I mentioned earlier, it tries to mimic like a Google search type functionality in that you can type the condition name, the procedure name. You can also type in ICD-10 codes like G56, and then we'll provide a direct linkage or mapping to those various ICD-10 codes. If you had ICD-9 codes checked, you can search by those. You can search by CPT, by NDC, and by HCPCS. So we really allow for a vast kind of array of finding information here. To get back to the home screen, you can always click on home here, or simply by clicking on the ODG by MCG logo, that will always take you also back to the home screen. So again, just to kind of recap really quickly, you can search by medical topic name, procedure name, any of the items listed here in the provisioning tools, ICD-10 codes. We've also designed some shortcuts for people. One of the things that this new ODG by MCG website contains is some configurability aspects to it. So you'll see here we have the top 10 to 15 return to work diagnoses, and these are all quick links. So if you were to click on any one of those, it would take you into those specific topics. You'll also notice over here to the right-hand side, we have top 10 to 15 medical treatments, which are also quick links. Last but not least, you're going to see top conditions down here, which I'm highlighting in a binoculars. If you were to click on the binoculars, we've added the top 100 conditions in alphabetical order. And again, these are all quick links. So the goal of this, again, was we know people are very busy with caseloads. We're trying to get to the information as fast as possible. Again, just to get back, we can click on the ODG by MCG logo here. And then last but not least, from a searching perspective or functionality, you'll see this human anatomical design here with the yellow nodes. And as you hover over the yellow nodes, it's going to point to the body parts of the treatment chapters. So these will take you directly into the treatment chapters themselves. Last but not least, we have guidelines by state down at the bottom. As many of you are aware, in the workers' compensation world, ODG is the predominantly adopted and legislated evidence-based treatment guideline by over 10 to 15 states for our formulary and our treatment guidelines, where we've seen great success in terms of improved outcomes. Some states have their own guidelines, and then you're welcome just to click on those, and we'll take you out to the state link for those sites. So again, I wanted to start with search because everything really kind of happens there and gets predicated from the search. So just to quickly recap, you can use the top to 10, 15 return to work diagnosis links, the medical treatments, the top conditions, the anatomical design, which links you directly into the treatment chapters, and then last but not least, where most people probably hover, is this kind of Google type search functionality, where again, you can type in the ICD-9 codes, 10 codes, CPT, NDC, and HCPCS. Moving along into the demonstration, let me actually take a topic here like back sprain, and let's take a look at what it does when we click on that. You're going to notice again, I'll point your attention to some green check marks here are going to appear in the tabs where we contain information. This is alerting your users and your staff that there's information on this topic in these various different tabs. It automatically defaults you into our duration or our return to work tab, where you're going to see 3 values, an M, an A, and a B value. From a configurability standpoint, you could also decide to eliminate the M value and simply have an A and a B value. So there's some different options here. Not only is ODG fantastic for helping people return to work, functional improvement, improving outcomes, but also I have some report or some analytic dashboards pulled up that I would like to show you, because a lot of people and customers of ODG are simply using the guidelines to help manage people back to work, which is fantastic. But one of the other things that you can really do as a derivative of using this is benchmarking analytics. You know, benchmarking your result against our normative database of millions of cases and claims to identify improvements, where you're doing well at, reporting back to clients if you're third-party administrators or self-insured employers or insurance carriers. I'm going to take a moment just to describe these 3 values because they're extremely important and they all work together. So I'm going to draw a line right here between the MA and then the B value. The M and the A values are depictions of our normative database, and our normative database consists of over 10 million real-world de-identified cases or claims that goes for the ongoing development of our guidelines. Annually and continually, we're getting refreshes or dumps of these de-identified data from major contributors such as insurance companies, TPAs, self-insured, self-administered employers, state funds, etc. That de-identified claim data goes for the ongoing development of our guidelines. The M value is the maximum anticipated return to work. Some groups use this as kind of an MMI or a medical, an MMI value, but it is the 100th percentile, basically depicting that 100% of the people have returned to work within this time frame. The average is what we call claim typical, or the 95th percentile, where we exclude the 5% of the outliers. You wouldn't really want to manage your cases towards the M and the A value, though, because it consists of 2 factors at a very high level, the medical factors and the non-medical factors. So as many of you are probably nodding your heads as you're hearing this on the phone, or would agree with me in that, when we're handling these cases, many times not only is it just the medical condition, but there's what we call psychosocial factors or the non-medical factors, which are really, do people like their managers? Every day they've been off, it becomes harder to get them back to work. There's other things going on in their lives. And so as a user of our product, we're looking at the M and the A values from more of kind of a benchmarking standpoint, or to identify here's what's likely to happen in the real world based on ODG's arbitrary normative database of millions of claims. And again, it consists of the medical and the non-medical factors. ODG then has a world-renowned medical advisory board of hundreds of physicians who review the real-world data and come up with our best practice timeframes, which are more indicative of physiological healing times. So the way that we would think about this is if you had a back sprain from a car accident, from a workplace accident, from a disability accident, from a group health, right, that back sprain doesn't understand if it happened in a car, a workers' comp case, a disability case, a group health case. What we're trying to do is manage towards the healing times of those back sprains. And so that's what the best practice is. It's the target we're shooting towards. So again, in short, what we're trying to do is get people from point A to point B. So A and M are describing the real-world data that we've collected. B is the target we're shooting for. Many times the B time frame, the best practice, can be a little bit aggressive, noting that it's based purely on the medical and the physiological conditions and motivations and things like that. But where we make the outcome improvements is we actually manage towards this and then benchmark back against the real-world data points. I'd like to point your attention over here importantly to what we call our risk assessment score. This risk assessment score takes on a numerical value in a color-coded thermometer, helping identify complex claims early. This is extremely important to alert your staff members and users so that you can put the right attention, the right resources, the right allocations on the right claims at the right time. Especially in an integrated format, the risk assessment score can help with interventional triage. Again, focusing your attention on the right claims in the right time. The industry threshold kind of sets it at 60. So if it goes above a 60, you might decide you want someone else in this case. You might do some dashboards based on claim profiles of your teams to understand where those are. You might have some new folks that have all high and extreme categories, and you might want to start them off with some of the low and moderate claims. There's also some things you can do with auto adjudication on the front end if the claims are in the low and the moderate. So these are all things that the ODG sales consultants are here to work with you on. You know, our goal really is not to give you a website just to use daily, but is to really get to understand your process better, help with the analytics, help with the integration so that you can do more with less. Let me just point your attention now up here. As you're probably wondering, many people have more than just a simple back spring going on. So you'll notice this refine button here. When I click on this refine button, what it's going to do is it's going to open up a series of additional boxes that are going to allow us to get to a claim-specific level duration versus a diagnosis duration of back sprain. So here, what we can do is, by clicking on that arrow key, we can see here are the various different job classes, and as I hover over those, it's going to give you examples of what those are based on the DOL definitions. So you can choose between very heavy, watch the time frames change, versus what if we could get them into a light roll, for instance, and then you'll see what those durations look like in a light roll. So you'll see they're kind of changing based on the job class that we put. Very uniquely to ODG, and part of what we would call the three-prong return to work process is understanding, first of all, what condition does someone have and kind of what do those durations or recovery time frames look like. But secondarily, what we really need to understand is what do they do from an occupation standpoint. So what can we get them into modified duty, transitional duty? So many times, sometimes job can be kind of straightforward. But what we've done is we've partnered with a group called My Abilities to bring in a job-based data bank of over 30,000 jobs where you can start typing in welder, for instance. As I type that in and click on that here, you're going to see it's making a connection now, and now you're going to see a green check mark appear where the job profile tab was, again, demonstrating to a user that there's information there in that tab, so that when you do click on that, now it's going to bring in momentarily a full description of the job. It's going to bring in a demand score, and then it's also going to be bringing in physical demands of this job. Right? So the demand score, what that means is it's in the 80th percentile, meaning comparable to other jobs, 80% is higher in physical demands. And if you click on any of the, for instance, like arms here, it gives you what this person does on a day-to-day basis. So it gives you an idea of what they're doing, because many times when the person goes to the physician, the physician doesn't really understand what they do. So you can actually share this job profile out by creating a PDF. You can also customize these. So if they do a little bit more different driving or controls or climbing, simply by clicking on Customize here, you can enter in some information, customize the job profile. For the sake of time today, I'm not going to do that. But it's a very unique feature to ODG, extremely important in the return to work process so that we can start to do that. In the near future, we hope to bring in cognitive demands as well as psychosocial demands. Again, so all I did here to get to there was start typing in the job application. It made a connection to the DOL job class. It then opened up some information here where you can create more information to understand what this person does. To get back to the duration tab, I'm simply going to click on duration, and it will bring me back. Now we can start to customize this a little bit more. So we know various different states have different outcomes. Again, remember, the B value is the physiological healing time. So that's not going to change much from state to state, although that we know the outcomes do in the real world. So you'll see some of those change here. We can put in the person's age, maybe they were 45. Once we do that, it will refresh. It's now changing the best practice. You'll see the time frames went up. The risk score is also changing. We can put in the date of the injury. So maybe the date of the injury was June 1st. It's going to calculate a return to work date. So it's going to calculate 19 days from June 1st as a target return to work date of June 20th. If you prefer to use the time frame A here, all you simply need to do is click on this here and go to typical return to work date, and then it will calculate 32 days or the A value from the target return to work date. You can now parse here between our workers' comp and our disability data sets. Again, the B value doesn't know the difference between the various different injury types, but the A and the M values do, because we know in workers' comp inherently has some longer durations than disability. So let's take a look at a workers' comp case here. You'll see the time frames have gone up. The risk assessment score is now adjusting. Excuse me. You'll also notice that we have 9 of what we would consider the most common impacting or confounding factors to the case, but you're not limited to these 9. So maybe they had depression or some psychosocial issues here. Maybe they also had hypertension. But we can also see now it's kind of added those days. The risk score is significantly jumped up. What we can also do now here is you can add in up to 10 conditions by simply typing in multiple conditions. So for instance, I'll type in carpal tunnel syndrome. Now you're going to see we have 2 conditions pinned up here. You'll see that we're looking at multiple conditions here, and now you'll see the values have changed. Okay, so again, we're managing towards the best practice time frame. We may not hit that overnight, but what we do want to do then is start benchmarking that against the average. Down here, I'm just going to point your attention. Again, remember the way that we architect the website is kind of deep linking theme in mind. So if you have staff that maybe don't have as extensive medical backgrounds as everyone else, you can look here at Medline Plus. We're going to link you out to the National Institute of Library of Medicine, where you can see static images, definitions, right? If you click here to keep reading, symptoms, exams and tests, treatment, surgery, outlook, complications, when to contact the medical professional, prevention. So referential information to support your decision-making process. And we link you right to the actual conditions that you're on. We also contain, for people who learn better visually, 3D animations. These are quick 30-second to a minute clips.
And extending of tendons in the hands and wrists, especially over long periods, are a common cause of the condition known as carpal tunnel syndrome.
So I'm not going to go through the whole thing. I think you kind of get the picture here, but this is going to give your staff an idea of what's going on with the patient so that they can better work with them and understand what's going on. You'll see down here below, we have some various different scenarios. These scenarios are intended to support the human intervention of the case management process, i.e., or for example, if your staff members feel like one of these scenarios better describes the patient, you can simply click on these and it will automatically override the durations up here, allowing for the human intervention to be the most important part. You'll see we have codes related to this topic, both ICD-9 and ICD-10. Unique and importantly to ODG, we provide a capability and activity modifications for restricted work. So things that someone could be doing in a manual or a regular work role, lifting, stooping, standing, repetitive motions, things they could be doing in a clerical modified role, as well as carpal tunnel syndrome, things they could be doing in a regular duty role, modified duty role. Access to our physical therapy content and our chiropractic content. So it's a brief overview, just to kind of run through the duration tab here really quickly. What we simply did was we brought up a condition, we refined the results, we entered in the additional information, putting in the job class and linking out to the job profile to see a demand. It's rearranging the time frames based on the demographic and the information that we're inputting here. We have a risk score to identify the complexity of the case or claim. Again, awesome for integration and decision support so that you can triage the right cases to the right people. You have some information here if you want to learn more about the condition. and we have videos here. I'm happy to announce in the next few months we're going to have hopefully a major release here where it's going to augment some of this clinical information with some additional information our RNs and certified case managers have been writing. Again, ICD codes, capability and activity modifications, physical therapy, and chiropractic. One of the tools that is probably my most favorite tool on ODG that I think has the ability to demonstrate and make improved outcomes on helping people back to return to work and functional improvement is over here, located on this timeline, which we call the return to work prescription, or underneath this print button. So for instance, if I click print, you'll see it says return to work prescription, and I'm going to click on that. Once we have all this great information, what do we do with it next? What we want to do is share this, right? We want to get out in front of these cases. We want to start having a goal to shoot towards. It's okay if we don't hit the goal overnight, but at least we have something then that we're working towards and a document that puts everyone working towards consistent outcomes. This tool here was designed actually by one of our frontline users of ODG, and they were able to improve their outcomes by 35% return to work durations by using this form. And here we can see I have some information just kind of teed up in here already as I kind of go through. These are all optional fields. You'll see the physician name. I'm just kind of inputting some test information. You can use our recommended text that says, please review and modify the enclosed ODG guidelines for return to work. I've also included a job function evaluation form. We'd like to put a return to work plan in place. Very non-adversarial, very open-ended, allowing for that communication process to happen. Here you can see we're using the average time frame. We could also click on the target return to work. You can bring those scenarios in. Every field here is a rewrite button. So if you wanted to type in your own information, you simply could. We're going to enclose the job function evaluation form. Let's use some modified duty. And then when we hit create printable document, it then creates a very nice, succinct, clear, clean form that you can then share. Listen, I think many of you would agree on the phone. Unfortunately, many doctors haven't been trained in return to work and stay at work. There are quite a few of them, right, who are occupationally and board certified, and I think we're starting to see a shift towards this. But again, remember, a lot of the family practitioners and groups are sometimes they're just asking the patient, how long do you think you need to be off of work for, which kind of gets these cases off to a bad start. It allows those non-medical factors to creep in. So by utilizing this form, you know, if we say, Dr. Williams, why isn't the person returning? We use ODG. You might not get the results you want. But if you use it in a very condensed and kind of open-ended, non-adversarial form, like Dr. Williams, my name is John Nelson. I'm trying to help Jane Doe back to her productive endeavors. You know, we use evidence-based guidelines from ODG. I understand it's a guideline. I know people heal differently. It's simply a goal we're shooting towards. If you have, if there's something else going on with the patient that we're not aware of, please let us know. And that sets those expectations. The most key part of this process is really the communication. So this form is really pivotal in helping improve outcomes and getting the cases off to a good start. And then you'll see it contains the information here on the modified duty. And then down below, it even has an ODG job function evaluation form where the physician could write the return to work release note based off the information up front here. One of the unique approaches ODG has is we have many staff members on hand who are RNs, so they're nurses, they're clinical folks, but they're also certified case managers. And they've written some really nice introduction letters to these that help describe what ODG is, but also they've worked for various different insurance carriers, third-party administrators, UR, IME, peer review groups, and they can help bridge the gap because they sat in the same seats as many of your staff members. So again, to the point of kind of the consultancy on this is we're not just giving you a website. We have a team of individuals here that want to understand your process. We want to understand your goals of where you want to get to, and then we want to set a plan in place to help you get there. And those certified case managers and RNs sitting in shoes such as your users can help really bridge that gap nicely. So this return to work form is really valuable. If I come back here to the durations tab, Again, I got there by clicking on the print and clicking on the return to work prescription. You can always print any of these pages for documentation. One of the other things you can do is copy and paste this URL so that you can put those into any types of systems so that your staff can always come back to here, and it's a very longitudinal way to case manage. So if something else needs to be invoked in the case, you can come back here and do that. Let me come over here. I have some analytics, kind of just an example of some analytics and types of reports that can be run and some of the things that we like to do for our clients. You know, we can do a year-over-year kind of look at your duration. We can look at year-over-year report by top diagnoses. So you may have a different kind of mixed bag of cases or claim types in other companies, and understanding, you know, what are your top 10, 15 diagnoses? How do those relate against ODG? Maybe you're doing really good at the mental health conditions, but it's the musculoskeletal conditions we need to work at. We've run our risk assessment score up for some major carriers, and we were able to identify, for one, that 15% of their claims that accounted in the high extreme were 85% of their costs. So now they know where to focus those attentions on to help improve those outcomes and save money. Down here you can see you can triage, you can create dashboards based on that risk score. You can also benchmark your results. So for instance, you know, would be Acme Insurance would be a company here in the green. How does your back strains compare to the ODG max, average, and best practice? So, you know, again, if you're doing very good at mental health claims, but you need work on the musculoskeletal, or vice versa, maybe you decide to put more senior people on those coming in. So this is much more than an encyclopedia type reference tool that we can use for business intelligence, analytics. This is great for demonstrating back to employers improved outcomes. You know, if you were to try to do this on your own, employer, here's where your outcomes would be based on the ODG normative database. Here's where we are. So there's all kinds of various different intelligence and analytics that can be derived from those, and those are things we want to help with. So right now, I know I'm kind of covering a lot in here because we have a few more tabs, and I certainly want to get to some of the questions. We've covered the duration tab. We've covered the job profile tab. Importantly, I'm going to toggle over here to the cost tab, and you'll see here on the cost tab, we break it down by indemnity, medical, expense and administrative, and then the total cost. We default it to claim typical, but you can toggle between the claim max, claim typical, and best practice, those three values from the duration guidelines. You'll notice as I was putting in, sorry, you probably didn't notice that, but as I was putting information into the duration tab into this here, it was actually changing things on the fly on the cost tab. So for instance, if we were to toggle the Colorado, watch the time frames, and not the time frames, excuse me, the dollar amounts changed here. If you know what the average weekly wage of the individual is, you can input that there, and it will adjust the cost. So it takes into account the average weekly wage from the states, but if you know what that is, you can change that. And for instance, if we were to add legal representation here, you'll see the expense and the administrative go up. So these types of things are synchronously happening as your staff members are entering the information, allowing you to gauge what a typical case or claim can look like. And this is based off millions and millions of cases that ODG has collected and can augment different types of reserve tools that you have, but also giving adjusters, claim managers, case managers an idea of what those costs are. From a benchmarking standpoint, this is another great tool that you can go back to employers with on cost savings. So, you know, if you got someone back to work in kind of the best practice time frame, comparable to the claim typical, you can deduct the difference there, right, to understand what types of cost savings you're going to see. So our cost tab is going to give you information on what a typical claim cost looks like based on indemnity, medical, expense and administrative, and the total cost. If we were to change this to disability claim, the medical would go to zero because we know in short-term and long-term disability you're not paying for the medical piece of it. So again, as you're typing in information and doing things, it's happening also in the background in these tabs. So very important, allowing users to toggle here between the various different functionality tabs to get the information they need readily. Again, you can copy and paste URLs from here. You can print this information off by clicking on print page. You can see it kind of costs it in a PDF. so that you can add those to any of your documents or files and so forth. So coming back to the duration tab here, let's go ahead now and look at the 3 tabs that we haven't covered yet: treatment, TAU, and formulary. So many people are very familiar that ODG is the de facto gold standard in evidence-based treatment guidelines, being the most adopted and legislated by various different states. I think we have 10 to 15 states now that have adopted our formulary and treatment guidelines, with more looking at it currently. And so if I were to click on the treatment tab here, what you're going to see is our editorial team. The first thing they did is they went and they reviewed the best matches. So these are the first matches that you're going to see. These are the types of treatments that we see quite often. And then it scrolls down into other matches. You'll notice here that there's some color-coded circles. R stands for recommended. CR stands for conditionally recommended. O stands for other. And R stands for not recommended. If you scroll down, it kind of goes in alphabetical order along with the matches here. And if you hover over any of these, you'll see the actual recommendations. And then if you actually want to click on them, you can by clicking on them. It will actually bring you into those recommendations where we can see exercise is recommended for treatment and for prevention. Here's our evidence summaries. So if you have time, you want to learn more, you can click on any of these articles, and we'll even take you out to the PubMed articles that you can see those for further documentation. Just coming back here, let me show you what most of our users do though. Because this is such an extensive list, what we allow is for some provisioning or for filtering. So what we can say is, maybe I only want to see what's recommended. And this is giving, obviously evidence-based treatment recommendations, giving preference to randomized controlled trials, in the pyramid of evidence-based protocols. And then you can see under categories, diagnostic testing, electric stimulars, imaging, implants, injections, medication, PT. Let's do a few examples. Let's say if I want to see if an MRI or a CT is recommended. So we could go to imaging, for instance, and now you're going to see here are the various different ones. Let's choose MRI. Excuse me. Again, it's going to follow this format. You're going to see the procedure name or type here. It's going to say the body system, the treatment type, the related topics. Importantly, and probably most importantly, here is your recommendation statement. It's conditionally recommended prior that it meets the indications for imaging for MRI. So now here you're going to see kind of red flags. It's got to meet these indications. And then again, here's the evidence summary. So underneath red flags, if your users have time and they want to see why, you click here, and then it brings you right out to the PubMed articles. That you can see reference, transparency, where the information is coming from. Down below, you can see a timestamp. So this was last reviewed, modified on May 21st, 2020. Again, you can share this information by copying, printing the treatment info here. To show you just another quick example, maybe we want to see what's recommended for PT. If you were to come down here, we would just select the PT category. And then you'll see here are all the recommendation procedures and therapies for treatment. You'd click on physical therapy here. Again, the blue boxes, the most important, drawing your user's attention, your staff member's attention to that. You'll see the various different visits over the associated number of weeks. From a clinical perspective, we also have a treatment planning section so that if you wanted to see what a typical trajectory of the case would look like, right? The treatment plan is not designed to be a rule. I want to make sure we're all aware of that it is a guideline. But here's what you would expect on the first visit with the primary care doc. Medical history, sensations, ruling out red flags, talking about the impairment criteria. One of the tools that we're bringing into ODG is going to be an impairment check where you can see the various different versions of the AMA guidelines without radiculopathy, identify the radicular signs, with radiculopathy, what to expect on the second visit, the third visit. So this is kind of giving you an outline or a plan of what to kind of expect in the case. So just to kind of recap on the treatment section here, what we did is it's bringing in the best matches, alphabetical order. You can filter the recommendations here by clicking on here, the various different categories in the body system. Very important, people getting the right treatments at the right time in order to help them get back to work effectively. One of the uniqueness of ODG is this next tab, and this is very important because it's really driven by a combination of both data and evidence, right? And so this is what we call our Tau index, and no other guidelines companies contain this normative bill review data that ODG does. And many of the largest insurance carriers and bill review systems integrate this content for decision support so they can auto-approve conditions as they come in, saving time, making sure people are getting the right treatments at the right time. So this can all be integrated via API web services. We have a gold suite or standard of web services that can call via XML or JSON and integrate into systems. But what this Tau index is doing, it was formerly called our UR advisor. Now it's considered our treatment analyzer on outcomes because we've added an additional column here. But it's taking real live workers' compensation bill data, and what we're doing is we're saying for any given condition, we're on back sprain, by incidence and frequency, here were the most common procedures done. And I'm just going to expand the results here a little bit here. But it's showing you the procedure code, the procedure name, the group, the frequency, the median number of visits, the average number of visits, the cost mean, the authorized number of visits, so that when you integrate this content or you're looking at it referentially, you could auto-authorize 6 visits based on the condition coming in so that you're getting people the right treatments at the right time and thus, allowing your human intervention to focus on the claims and at the time you need them to. Importantly, there's 4 different payment flag colors: green, yellow, red, and I'm not sure, there's the black. Let me describe what these are. Green means it's evidence-based and has links back into our contextual citations here found in the treatment guidelines. There's really only one issue with evidence-based medicine. There's not enough of it, right? We only have true evidence-based medicine for a certain amount of conditions where we give preference to randomized controlled trials, things like that. But what we do know is there's lots of procedures that might not have evidence behind it, but we see them with high incidence and frequency, low cost, and they get good return to work outcomes, which is this Tau correlation here, which gives you a score negative 100 to 100. The higher the score goes to a positive 100, the more commonly this is associated with good return to work outcomes. So an example of yellow would be like a hot and cold pack, right? There's no randomized controlled trials to say a hot and cold pack work for a back sprain, but we know they get good results, they don't cost much, and they're done quite frequently. And so the yellow ones, instead of putting humans on that, you're better off just auto-authorizing those based on the ODG payment flag. And you can simply search by just putting a hot and cold pack here, and then if you click on it, it gives you a little bit more information on the frequency, the visit percentile, the average visits, and the payment flags. So you can just start searching in here or by the CPT code. Again, when it's integrated in its best case scenario, it's automatically doing that information for you. It's bringing back this, and it's auto-approving those, allowing you, again, to focus on the ones that you need attention to. One of the things, so green is, just a recap, is the links back to the evidence-based treatment guidelines. Yellow is kind of a combination of evidence-based and data-driven. Red, you'll notice here, ODG would never use the word deny. What we're suggesting for a back sprain, and I always like to look at MRI here, is route for review, because it's got to meet the criteria. So again, when we were looking at MRI back in the treatment, what it would do in an integrated fashion, it was kind of kick that to a person to make sure it's meeting the indications to mean effectively that we want to look at the MRI. Because conservatively, MRI is probably not what we want to do first, right? We want to try some other things first to see if we can get this resolved. Degenerately, there's probably a lot of people who could go in as they get older and find things to fuse up, but it's probably not the first course of action. And then black is kind of even like a stronger route for review or with extreme caution. So you can let this content drive decisions for you so you can focus on the ones you want to. Very unique to ODG, the only company that's collected all of this normative data and producing these results for you and integrated into systems via an API. Last but not least, I want to cover our Formulary tab, which consists of medications, a binary list of medications here, starting with the drug class in alphabetical order. As you scroll down, you'll see it's kind of a long list here. What many clients do, though, is by clicking on the drug class here, you can kind of see the various different ones. By scrolling down, you can see it has by generic name, innovator brand, a notes field, a generic equivalent, does it have, and then importantly, just like in this Tau index, a yes or a no. So many states have adopted the ODG binary. We have a plethora of outcome studies that demonstrate states that adopt the ODG guideline improve their outcomes, both financially and from a return to work perspective. And then the cost. So the green and the Y means yes, it's approved as a frontline medication. For states where this is adopted, doctors don't need to get pre-authorization to prescribe it. It allows people to get the right medications at the right time. N means not that we would never see this, and it doesn't mean they can't prescribe it. It simply means we want a little justification as to why. And you can filter over here. So let's say maybe we only want to see opioids. You can do that. Or, for instance, let's take a look at Wellbutrin. If we were to look at Wellbutrin, yes, it's a Y for mental disorders, but an N for pain treatment. And when you click on this, again, then it links you back into the actual treatment guidelines where you can see the recommendations. And then it even brings you down here where you can click out to Medline Plus if you have time, where you can see more. It gives you the NDC code, the strength, the trade name, etc. Additionally, ODG has a morphine equivalency dosage calculator. So by clicking on this dot here, we can now say, what if they were on 30 milligrams of codeine and 20 milligrams of oxycodone? It's going to give you a daily morphine equivalency dosage by line item, and then also in the aggregate, coupled with our risk stratifications on the dosing guidelines, extreme. So by clicking on this, it will bring you in here. You can simply search. So, if you're looking for various different NDC codes, you can search by the NDC code, or vice versa, you can search by the drug, and we'll bring you to the NDC code. So very important. Obviously, many states have come to us to help them with their opioid prescriptions. Again, we have outstanding articles, outcomes that say, that talk about the successes states have amongst the adoption of ODG. Our formulary info is found here. We're very transparent in our methodology. On the treatment tabs, we have all of our treatment guidelines. When you click on any of these, it actually brings you into the treatment info. We have methodology, documenting exceptions, our editorial advisory board. ODG really has a focus on helping people back to work, getting the right treatments, and improving outcomes. I'm just going to come back to the home page here really quickly. I'm going to log in here. And you'll notice up here to the right of the code section under help and training, we have a very nice self-paced training where it goes over each of the actual tabs that I just went through, the duration, the treatment, the Tau. These are all 2 to 4 minute clips, so users can always come here and be reminded and get refreshers. As you know, we're on one today, so we have monthly live webinars. We have recorded webinars. We have ODG certification, our help desk, and our information guides. But just to recap, again, the 3 core components: evidence-based duration guidelines, treatment guidelines, and cost. The duration guidelines is going to give you information on expected recovery times, where you can come up here, refine the results, your risk scores, sending off return to work prescriptions. Your treatment tab is going to give you evidence-based treatment recommendations. The Tau index is going to be a mapping of evidence-based treatment guidelines for any given condition in combination with some data-driven bill review data that we've collected over the years. Very unique to ODG, great for integration. The formulary is going to consist of information on prescription drugs. Cost is going to give you an idea of a typical cost of a case or a claim, and the job profile on the actual occupation of the person, physical demands, psychosocial demands, things like that. So I know we have 10 minutes here. I really like questions. Typically, I think questions and the interactions kind of help spur if you have questions, there's typically other people that have questions. So Daphne, maybe we can kind of open it up to some questions here.
Hi, yeah, thanks, John. That was excellent. Let's see, we do have a question about, is this only available as a web subscription, or can the data be integrated?
Yeah, so what I've shown you today is actually the web version, but most of our large insurance companies, large TPAs, sophisticated groups integrate this content via an API or a web service call into case management systems. We've integrated with scores of systems. So we have off-the-shelf integrations with various different software companies found on our vendor page. We've integrated into proprietary systems. And what happens is you call for our content, and then it resides within your system, and the analytics and the intelligence become a byproduct. You can do auto adjudication. You can do business, all kinds of various different things that we're here to help you with. But if I could suggest integrating the content is the best way to use ODG. Thanks, Daphne.
Yeah, thank you, John. Let's see, do you exist in the AWS data marketplace?
So I'm thinking someone's asking a question about when we exist in the AWS. I guess I'm not sure if they're asking specifically in the app world or if our information is housed on like cloud servers within Amazon. But I can assure you, ODG, who rolls up to MCG and the Hearst Health Network, has the most extensive backgrounds in servers and confidentiality of that. We have all kinds of documentation that we can supply you, on the security of our IT infrastructure, business continuity plans, etc. So hopefully that answered that question.
Okay, great. And actually, that looks like all the questions that we have today. So if you want to
okay, well thank you, everyone. Please feel free to – sorry, Daphne, you kind of cut out there a little bit. Please feel free to ask us any questions. We're happy to help.
Okay, yeah. So here's our contact information here, odghelp@mcg.com, and our phone number. And thanks a lot, John. That was excellent. And all of you will receive this recording within 1 week, and you can get back to us with any questions you have at that time as well. Okay, thanks a lot, John.
Thank you, everyone. Have a nice day. Appreciate it. Bye now.